And when I think about stigma and mental health, I think about stigma as being one of the greatest barriers for people to come in. And a lot of the time, people have issues with transportation is one thing, money is one thing that comes into place. People's abilities to get around are all things that get in people's schedules.
Money.
Exactly.
Yeah.
That's a big thing that is, yes, a very big thing about getting into mental health treatment. But one of the really big ones is stigma.
Right, just getting through that door, I think. I mean, even if you have all of those things under wrap, I think stigma prevents people from even making the phone call.
Yes.
Yeah, it's interesting because stigma was not something I thought about until later in life. I started therapy at a very early age. I think I was 5 when I first went to a child therapist. I had lost my dad very early on. It was a traumatic experience, obviously, because it was sudden. And I think between my mom recognizing some things that I needed to talk about with someone who wasn't her, and the school recognizing that it was affecting my ability to learn, it was suggested that I start seeing a therapist. And I've been seeing a therapist since then, pretty consistently. I know, pretty consistently, but I mean, it does not escape me that I was very privileged in that my parents could afford to send me to a therapist. It cannot, like, therapy is expensive. If you, co-pays are not easy. And it also, I was very privileged to have a school that felt like mental health was just as important as any other kind of barrier to education, and really supported that and had services that supported that, not just in what they communicated to my parents, but I was in emotional support probably all through my public school experience. I had an IEP, which was an individualized education program that not all schools do. My school was in constant communication with my therapist, and my therapist was in constant communication with my school. So I'm very aware of how lucky I was in that the environment around me was not stigmatizing at all, as far, and very much a part of normalizing, hey, this is just some extra help, this is to help you figure out, and we want to get you through school, we want to get you into adulthood. But I think stigma came into play when I was a teenager probably, and it was more of, even though I had all these people around me saying, like, this is normal, this is okay, it's okay that you feel this way, it's okay that you go and get extra help, really taking that on myself and saying, but I don't feel normal, and I certainly don't want my classmates and my peers to know. So I think that was when I really noticed that stigma, and it didn't keep me from going to therapy because of my parents, but it certainly isolated.
And it can seep in through lots of different doors from society at large. There is, at least in the United States of America, a sense of mental health, like having a mental health issue is like a dirty sort of thing, something that will socially isolate you. The people on the streets that are like, that have issues, people that are living homeless, they have mental health issues, so stay away from them, they're dangerous, these are people that are going to. So there's all this social stigma, there are all these signals that tell you that having a mental health issue is a really bad thing, and your life's going to be out of control, and you don't want to be perceived in a way that's similar to these people that society tells you is dirty or untouchable sort of thing. And when the thought that, you know, this is something that might apply to me comes on, there's this thought of I don't want to look like that, I don't want to let anybody know that that's what's going on, and then that is exactly opposite of what needs to happen to be helpful for you, because in order to help, a lot of times these mental health issues that we have, you talking to someone, whether that is a mental health professional or your parent or a peer, that can get you connected with the level of services that's appropriate for you is what you need to do. But the stigma, social stigma, tells you that, that's not right. I don't want to be a part of it. I don't want to be perceived in that way. And again, getting in the way of you being able to get the help that you need.
Right. And I think what is kind of even worse about that situation is that mental health already, if you are struggling with your mental health, one of the tricks that mental health kind of plays on you is you already feel isolated. You already feel like you're the only one experiencing these feelings. You already feel like no one else kind of knows what you're going through. When you struggle with your mental health, it's already a very isolating situation. To add on top of that, if I were to express what I'm feeling, people are going to turn on me, or I'm going to be looked at a certain way. It just adds to what is already a very isolating, very lonely at times situation. But I mean, I think what broke, for me at least, what broke that isolation that I had felt for many years with my mental health was finally just having a conversation with someone that was a peer and saying, let's just get this out there. I don't feel great right now. And there was like a relief in that.
Sure.
Which I think was unexpected, because what I was expecting was that person to turn around and be like,
"You're crazy. What's going on? Get out of here."
Yeah. Why do you feel that way? And that's not what happened. Which again is like, I feel very lucky that the first time I did express what I was feeling to a peer and someone that was a friend, it was handled in like a very beautiful way, and that's not everyone's experience, unfortunately, because mental health is so stigmatized. So if people don't have the education about it, or are kind of not aware and they're going off what is sometimes perceived in the media, that can be a very ugly kind of conversation.
Yeah. Stigma is a barrier to getting information, the correct information. You're not gonna go on the internet and look up these certain things because they're thought of even they could look at my history, or they could see that I'm looking at these things, and then they're gonna know something about me. But it limits your ability to access information, to make informed decisions about what's going to be good for you, what's going to be helpful to you.